Here, Commissioner Morgeson from the County Board.
Joel Lorenz, County Finance Director.
Matt Oberly, County HR.
Karen Deutsch, County HR.
Greg Courier, Aon Solutions.
Jolene Front, Aon.
Patrick Bloomingdale, County Administrator.
Mike Boyle, the only county board member that showed up. Thanks, Mary Ann.
That's right.
Howard Shandell, Midwest Benefit Advisors.
Tim Longwell, Midwest Benefit Advisors.
Pat Bourne with Aon.
Kim Bolo, County Clerk's Office.
I'm Diane Carlson, Deputy County Administrator.
Doug Kagan with Nebraska Taxpayers.
Gina Sandlin is Silverstone.
Tara Hirsch, Silverstone Group. Stephanie Unger, Silverstone Group. Lucy Padilla, County Clerk's Office. Carol Donnelly, County HR.
Okay, thank you. Welcome, everyone. We will first go with a presentation by Midwest Benefit Advisors.
Great.
Welcome.
Well, thanks.
Thanks.
Well, thanks. Since we've already introduced ourselves, we're here today because Mary Ann attended a seminar of ours where the central theme was misaligned interests, lack of clinical and financial management with most healthcare plans today. And our presentation will show Douglas County and their stakeholders that they can receive the highest quality of care at the lowest cost. We all know that it takes data technology, but it takes clinical concierge support team to help patients get the right care at the right time, at the right place, making sure they're the right patient, and at the right cost. So Midwest Benefit Advisors, we're an independent, next-generation business consulting firm bringing quantifiable solutions that add real value to your bottom line. We manage health plans for companies such as Farmers National, whose healthcare spend has been strategically managed to a trend of less than 2% over 5 years. The Nebraska State Troopers, City of North Platte, have health plans currently with our care coordination model. You should read what the troopers are saying about this solution at our website. We've been investigating and vetting next-generation solutions that will move the needle and deliver EBITDA from your health plan. We manage in excess of tens of thousands of employed lives utilizing a variety of self-funded arrangements, and we collaborate with strategic partners across the country so we can serve all size employers. Here's what we perceive Douglas County's pain points to be. We're a medical spend of almost $33 million, projected to increase to $39 million, as reported by Doug Kagan and Nebraska Taxpayers for Freedom. With this kind of trend, is there a medical management strategy in place that's going to reduce the frequency and severity of claims? Increasing cost indicates claims data mining and predictive claims modeling is either not effective or not being performed. And then cost shifting, we see large employers shifting to employees as a way of reducing costs, and all that does, it keeps them from accessing care and creates large claims down the road. With a healthcare spend of $16,000 per employee per year, that's $5,000 above the national average, so told us by Milliman Care Guidelines. And $11,000 is for a relatively broken plan. So at $5,000 per 2,100 lives, there's $10,500,000 of potential overspending. And this is told to us by Milliman Care Guidelines. In our opinion, RFPs generate activities with little results. Consultants, carriers earn the same with more or poor plan performance. And Douglas County's healthcare vendor partners' goals are not aligned with the goals of members, patients, the plan, and the provider. We look at this chart. You see where Douglas County is at 16,000. You see what is between moderately and severely broken. And you see it relatively broken is the national average at 11,000. But there's strategies, there's solutions that are available to reach that 11,000 and actually reach our block of business of $6,900. There's a cost of doing nothing, the cost of inaction, and that's equal to the cost increase and the lost savings that could have been achieved. Potential tax savings can help fund a lot of projects that you guys have been visiting with today. Maybe give employees a raise. There's just a lot of misaligned interest in the industry. Health insurance carrier stock values have skyrocketed since the Affordable Care Act. United Healthcare, stock up 2,900%. The worst performer in the group, Humana at 842. Hopefully you have these in your portfolio. You know, the U.S. middle class has gone backwards financially. I moved on to the next slide. In the last 20 years, and the culprit is our healthcare system, most American families could have $5,000 in their pocket each year, but due to deductibles, premiums, out-of-pocket taxes devoted to healthcare is rising as fast as the Buca stock prices. Prescription drug pricing disparity. You know, the question we like to raise is who's managing your healthcare supply chain? You look at this consumer report, price for the same drug varies from healthwarehouse.com to Costco to CVS and Target. The next slide is a sampling of an analysis we did for a client of ours with 225 employees with the same PBM as you now have. We were able to identify 37 name brand prescriptions that can be purchased alternatively for a $52,000 first year savings. While delivering that drug, 90-day supply, zero copay for the plan member. You're 10 times the size. That just means 10 times the savings. You know, there's disparity in drug pricing, right? We're all familiar with Harvoni. We've heard it advertised on the 6 o'clock news. The other two I cannot pronounce, but they are for MS. Those three drugs alone, $150,000 savings if purchased right. And it's about managing the supply chain. You know, there's pricing disparity in inpatient surgery charging. This is in Pittsburgh. This is a heart. Both hospitals in the network, 293% difference in the pricing for that facility. But who's on the risk? The employer. Because the plan member, they're going to have the same out of pocket no matter where they go, right? And maybe Allegheny General's, you know, around the corner. I'd rather just go there. It might be easier, right? Where's the incentive?
Could I ask you the survival rate, or is any of that ever farmed in?
I'm sorry?
What about the survival rate of people who die at?
Well, if you're asking about quality,
Yeah,
okay. So quality, you can see, so these same facilities have the same volume,
yeah.
which means they're going to have the same volume, or the same quality.
Really?
Yes, typically.
Quality? Okay, all right. I thought.
But it's not hard and fast.
It's like going to McDonald's and Burger King, there's a big difference, you know. They all sell the same number of burgers, but one's better than the other.
You're right.
You're right.
But see, so here on the next page,
Okay.
you can see where the volume is again, identical. And this type of transparency platform we have available for our clients can tell us what the ratings is, so we can find, Mr. Boyle, the
Yeah.
highest quality at the lowest cost.
Okay.
So we look at it, Irvine, California, same thing in Dallas, all across the country. And we have the data for Omaha as well, and Nebraska and Iowa. So next few slides, again, we talk about misaligned interests. So here's a national broker touting the amount of business they have. Larger the volume, the larger the compensation. And we are about aligning the interests of the plan member with the plan and the provider. We want to put everybody on the same track going forward. Status quo thinking produces the same old results. I think Albert Einstein said it best. We can't solve problems by using the same kind of thinking we used when we created them. Right? I think he also said that doing the same thing over and over again and then expecting a different result, that's...
Yeah, insanity.
Yeah, exactly. So We want to make sure that all the partners, all the vendor partners of the plan are all aligned and all sitting on the same side of the table. We want to be that one to help you supply, manage that healthcare supply chain, because there's a lot flowing out the window. The picture of these two folks looking at computers. I don't imagine that you provide a corporate credit card for employees to go buy computers.
No.
Right. Well, your healthcare card is almost similar to a corporate credit card. Going out there, accessing healthcare, maybe without the right education, without the right resources. And we're accessing care. Those slides about the different surgical pricing in those facilities, that's a great example of it. Look, we all know here in this room the 80-20 rule, right? And if we're not managing that 80%, well, we're leaving way too much money, as we've already told you, on the table. But it's going to take supply chain management. It's going to take medical management, a strategy to help your plan members get the right care at the right time. Maybe it means holding their hand and walking them through the entire medical journey. Because all the data shows that that will help them get the right care at the right price. Taking advantage of all of these solutions that are available to us today. Moving outside the status quo, and that's where we need to be. So, all right, not too bad. I'm staying within the time frame. You got to trust science, data, and Midwest Benefit Advisors. If you provide us with 2 years of medical and RX data, we can reprice it and show you what you would have been spending, and provide you a cost analysis that can be a roadmap for high plan performance, increased benefits, and reduced cost. I don't know, Marianne, got a few minutes. Is there anything you maybe like to share from that, maybe a takeaway from the seminar?
Well, the takeaway, and thank you for the presentation, and again, we struggle all the time with, when we go to do our budget, that we have this constant increase in healthcare costs, and we all know that. And so this intrigued me because it was a different way of looking at things. And so that's where I'm kind of am right now, is to say, well, yeah, let's take a look at it. Let's do the deep dive. Let's see what there could be in potential savings, not only for the taxpayers, but, to the employee. I can't remember the gal who presented at your seminar. I can't remember her name.
Deb Alt?
Deb, but she was phenomenal, really, in kind of wrapping it all up in a pretty package for me. And so maybe even bringing her
Sure.
in when maybe at a full board presentation to have her back. But again, I think it's worth having us look at, are we missing something? Should we be doing things in a different manner? And again, it's only because we don't know what we don't know, I guess is what I'm saying. So.
Yeah, that's good. I like it.
So Marianne, this presentation didn't really, unless I just missed it, didn't really explain what your product is or what you do. This is just more than 30,000 foot level.
More
That's right.
information,
Right.
more
That's right.
information.
Yeah, so at what point then do we get, so the Fall County Board and then Aon is our consultant, and then others like consultants in the room, other interested parties get to see a presentation about what it is all about.
Well, again, we can give you a high level of the solutions we bring to the table. We have one solution that the state troopers are on, all right? And that's where we have Quantum Health as the care coordination engine. That provides that medical management solution, and that's in a bundled environment. We also have an unbundled solution where you met with Deb and her medical management solution and her team, where we bring in the best-in-class pieces to deliver the healthcare plan. So there's two different solutions.
But we have to analyze your data and then make some suggestions.
And,
So I'm just trying to figure out time frame here. So what is the next step?
well, I guess you're planning for 2020, right?
Right. So
Is that right?
Fiscal or calendar 19 for
Right.
premiums and things like that.
So January 1st of 19, we still have Blue Cross Blue Shield, and
And
we'll
you're under
have
contract
PPO.
with them until
2020.
right.
Yeah.
Right.
So until
So-
December 31st of 2019.
19.
So we have one more year.
Right,
Okay.
so we thought today would just be a nice high level, kind of give you a flavor of our mindset and where we think things can go. We can certainly get down into the weeds when you're ready to. But it's really just a data analysis. It's not overly complicated. And the data tells us exactly what we need to know. And then you turn it into actionable data.
So the data that you need, is that data that can be provided without violating any kind of privilege?
Yeah,
Yeah, I mean, it can be scrubbed so that there's no
Right.
HIPAA
No
information,
PHI,
but
right.
it's
Right.
just the aggregate claim
Right.
information for, they're asking for 2 years worth of claims.
Or for example, just your RX spend, so just your actual prescriptions that were purchased.
Yeah.
And wherever they were purchased, the dosage, all of that.
we could send you information
Yeah,
on
we
that.
have data requests for that.
So I guess I would ask that if that be done as soon as possible, considering you're gonna be leaving and then we're gonna change it, and so, how hard is it to get that information?
Probably with Aon and Blue Cross, we can probably get that together relatively easily, I would think. Just a matter of scrubbing it a little bit. One point of clarification, and I'll own this mistake, and it's a terminology mistake between Patrick and I when he was asking for the number of lives. We're actually like 4,600 lives.
Okay.
And so we have,
2,100 employees.
yeah, and so
That are
just a
So,
terminology
okay, so when you
issue.
say lives, are you saying belly buttons?
Belly
Yes.
button.
Yes.
Okay,
We're talking
that's
about-
fine.
We're talking
Okay.
about employees.
All right, but we got the
employees.
right number.
Okay.
Yeah,
As far as
Just looking at
employees, yeah, but if
Yeah.
you're looking at
2,100
total.
employees.
No, we're
Yeah,
not
we're
talking about
like
belly
$8,000.
buttons.
Yeah.
We're talking about
Right.
employees.
Oh,
Yeah,
okay.
we just base it on per employee,
Okay.
so it's
You're
same
correct.
metric,
You're
but
correct.
yeah,
Okay, as long as we're all talking the same
we are.
things. Belly buttons.
Yeah, belly button.
So as part of what, I'm gonna keep talking, so as part of what your presentation is, you will incorporate our data into your presentation, so that's why you need that data.
Correct, and then we can present both those solutions and tell you, here's what this solution could potentially provide, here's what this solution could.
And this is based upon, though, just, I think, so there's clarification, this is based upon employees being educated or counseled or directed towards the highest quality, low-cost provider, and
Like
the
a
plan being
concierge service.
structured that way so that there is a penalty if they don't pursue
No,
that?
it is the most compassionate environment
Okay.
you could imagine being in. Whereas, the typical model, when I call to see if a provider's in the network, is to answer the question, see if I have any additional questions, hang up and get to the next call. So the platform that the troopers are on, it's just the opposite. We engage them. So you want to see Dr. Longwell. Well, Dr. Longwell's in the network. Well, he's a cardiologist. Why do you want to see him? And again, we're engaging the patient. And maybe the patient doesn't need to see Dr. Longwell, and maybe they just need to see their primary care doc.
It's a 5 to 7 minute call usually.
Right.
If the employee doesn't want to talk?
They don't have to.
They don't.
Okay.
Yeah.
Then you want to self-refer out to anybody you want, based on what Google tells you? Absolutely.
Yeah.
So it's not an environment of rejection and
Okay.
no, it's inclusiveness, it's to provide resources and education to guide that member. It's not to say go to that doctor instead. You want to go to that doctor. Here's the resources that you should know. They have 25 lawsuits pending, but it's good to know that.
Then we can play our website up here, our medical management.
Yeah.
2 minutes.
We're at 20 minutes, so.
Yeah, we're at 20 minutes.
So Tim was just saying, on our website at mbainc.us, we have a short little video about our medical management strategy, but
Look at that.
So what do you think, Commissioner, about next?
So the next steps would be for you to put in your request of what data you need so that we can do that analysis to see if we want to move forward
Who
with
do you
the
want us
next
to
step.
send it to?
So the request would go to Patrick,
Okay.
our CAO, and then he would work with HR.
Okay.
How many employees are with the troopers?
they have a little over 500.
Just curious what the scope of their organization is. Okay, thanks.
You're welcome. Any other questions?
On your website, you have other things that we can look at, right?
Absolutely.
Testimonials. and
Testimonials.
stuff.
Blogs,
Yeah.
you bet.
Okay, all right. All right. Any other questions?
Yeah, Commissioner Morrison, and sorry, this might be a question of, I should know, but my experience with the county is that this kind of work will be done by the incumbent consultant, and that without some kind of a bid process to look at the consultant so that they can bring the solutions, that would be hard to do. So is it possible that other firms can get the same information that Midwest Benefit Advisors is requesting and present a solution as well?
Sure. Sure.
We don't have to bid this, professional service, is that it?
No, there is just data gathering right now.
Oh, okay, all right.
So what she's saying is Ann is our consultant, so they will be helping us with the information that they are requesting. And then, could I just get clarification, so what specifically, you want, when I get the information,
Well, they have to put in their data request
okay,
like they're putting in.
so,
I think because they're looking at providing another alternative similar to.
oh, I see what
Midwest
you're saying,
Benefit
okay, so you'll
Providers
send me an
has.
email asking for whatever information you want.
Yeah.
And then they'll send me one, and then I'll just give you, okay.
Yeah.
Okay.
Should be the same data.
Right.
Yeah.
I just want to comment that our taxpayer group would like the county board to pursue this initiative. They're supportive of it.
Okay.
Thanks,
Any other? Again, I mean, what I said at the beginning is you don't know what you don't know, and
Right.
so
Yeah.
it's good to have as much information as possible as we move forward. Joe?
You know, this was an issue in our budget. When I first took the job, our big crisis was the pension plan. We managed to make some changes to the pension, we had that kind of under control, but every year now when we do the budget, this is the area that's probably within the county that's showing the greatest increase, and as the number is there, it's $32 million. It's sizable money. You know, the next thing on the agenda, we're gonna go through some numbers to show that the actuarial projected premium increase for next year should be 10.8%. So this is really a hot button for us, so we really have to look at our options and see what's out there.
Right, there's nothing wrong with that. Okay,
Okay.
any other questions or comments?
Thanks for bringing it in.
Yeah.
Thank you.
Thanks for your time.
Appreciate it.
Commissioner, I'm sorry, Commissioner Duda, did you have, oh, no, you were all right.
Okay, so, you guys can stick around if you want, we're gonna talk about health insurance premium increases, you don't have to, but
That's not, thanks, Blake.
Okay, next is
otherwise.
medical dental plan renewal rates.
So Craig Courier, Aon Financial Manager, is gonna go through the projection for
Okay.
the renewal.
All right. Okay, okay.
Yeah, you bet. Yeah, you bet. Have a good one. Take care. See you again.
Thanks.
Do you need one, sir?
Let me know if our electricity came back on, okay?
Okay. Thank you, everybody.
Oh, thank you.
Thank you.
Thanks.
So Matt, when they say, hurry up and get this project done before you leave, what happens if in a week or two you say, oh, I forgot?
That remains to be seen, I guess. I'll try a little experiment and let you know how that goes. I may not be welcome after.
Yeah, I think I'll be in trouble if that happens.
Yeah.
I'm gonna move down here. Swear.
Okay, sure.
No offense, Mike.
Nothing at all. I
Started.
forgot my deodorant.
I'm gonna sit on your left
So I
side.
said my left side.
Should always sit on the left side, Mr. Boyle, not on the right side.
He's a taxpayer?
In fact, I tell every new hire, when they come to orientation, they need to go to Costco for their drugs.
That's correct, he does.
Every single time, because they're the cheapest. You don't have to be a
They're a
member,
low-cost
you can go
provider.
and get your drugs there. They're in network, just gonna do mail order, so.
Okay, who's gonna start?
Craig Courier's a financial manager for Aon, and he's gonna walk through the medical and dental renewal.
Okay. And what sheet are we gonna go off of?
Craig's.
The big packet or the single sheet?
The big
The big packet, okay.
So what we've got today,
are the expected costs, projected costs for your medical and RX plan design in 2019. On a self-funded basis, so it's really kind of split into two parts. The first part on that first page is on the left-hand column. That would be the ASO, or the administrative services fee that you pay to Blue Cross Blue Shield to pay your claims. Right now, we're paying $35 a month as per enrolled employee per month. That's going to, on 1/1/19, it's going to $36 per employee per month, which is a 2.9% increase. Right now, you're in a guarantee with Blue Cross Blue Shield. You're in the third year of that guarantee. So that 2.9% increase is firm, effective 1/1/19. With 2,168 covered employees currently, that fee is projected to be $936,576 in 2019.
This is it right here. I just don't know.
That's not the right one.
Ah, thank you.
That's the ASO piece. On the right-hand side are your, what you pay Blue Cross Blue Shield for stop loss. That's coverage on any member. It's a belly button with claims over $450,000. Right now, you're paying Blue Cross Blue Shield $22.68 per employee per month. We have an indication of that renewal. It's not firm. They want experience through September before they can come out before they'll release a firm renewal. That's going to $24.89, which is a 9.7% increase.
Have we gotten into their money this year, or they?
No.
And it's still 9.7.
Still 9.7. The market right now, we're looking at anywhere from 12 to 16%. So again, that's an indication. We have gone back to Blue Cross Blue Shield and asked for some different retention levels to consider, and a couple of additional carriers to quote on this. So, we'll get the best possible rate. We may even go to market if we get something we're not happy with. So again, on 2,168 employees, that fee with the increase is $647,538. On page 2, we're looking at the total projected cost for 2019. This is the all-in on your medical and prescription drug. 2,168 employees, that's where you're at right now. Claims administration from page 1, $936,576. That's Blue Cross Blue Shield. Stop loss premium at $450,000. Per individual is $647,538. Your HSA contribution for those employees, this is what the county contributes to those employees that are in high deductible health plan, $123,000. And then we estimate that the county will receive $1,369,691 in RX rebates back on the RX plan. So all in there on the fixed costs, $337,423. Again, that's after the RX rebates. The expected claim cost, projected claims cost for next year, this is 1/1/19, $36,200,251. That's medical and RX claims. So total expected fixed cost in claims would be $36,537,675. On a per employee per month basis, if you take that $36,537,000 divided by 12, divided by the enrollment count, your total expected cost then per enrolled employee per month is $1,404.43.
And say that again, you get that by taking the total,
You take that $36,537,000 divided by 12, divided by the current head count of 2,168.
okay, thank you.
So that $1,404.43 is where we're expecting the cost, total cost to be. That would be your fixed cost plus your claims for the plan year beginning 1/1/19. We show that you're currently funding, this is where the premium equivalents were set for 2018, to be $1,268.01. So in order to cover next year's projected cost, that's fixed and claims, you would need a 10.8% increase to the current funding in order to cover those costs.
And what was our current claims running in the current, I know we're not through the 12-month period,
Well,
but
we're projecting 2018 to run at $34,109,000.
so a $2 million increase then.
Correct.
In claims plus term costs.
Correct. And again, this is not a firm renewal on the ASO, or I'm sorry, on the stop loss. We're still waiting for that. And we also are waiting for the bids to come in on the quotes that we asked for from the other carriers on the stop loss. Page 3 and page 4 are the projections on how we came up with that $36,200,000 in medical and RX claims. We've taken the last 12 months of claims, made adjustments for large claims that may be in the experience period, and then we've trended that forward using a suggested trend from our actuarial practice. We're using 6.8% medical trend annually and 8.9% on the RX. So we've taken the last 12 months, made adjustments for large claims, and then applied trend to project the 2019 medical and RX claims, $36,200,251. Again, page 4 is just the experience that was rolled into that projection. Page 5 is where you're currently funding. You've had your different plans and the enrollment. The left-hand side is the premium equivalence, that's the all-in, that's the employee contribution and the county contribution. And if you look at the very bottom.
So, I'm sorry, so if I look at the very bottom, are we saying that the employer or the county is paying 85%
Correct.
in total?
Total.
And how would that compare to your universal providers?
Slightly higher.
It'd be higher, wouldn't it?
Yeah.
Of course, our universe is governed largely by union contracts and comparability so it's a little different than comparing it to the larger clientele.
And we are gonna have some of the $300 plan people come off as of 1/1/19 as well, assuming that things are still in contract with those negotiations.
Yeah.
That will help our
We'll be,
projection a little bit as well.
we'll be down to about 80 employees that will be on the high deductible plan in January of 2019. I'm sorry.
Moving
The low
from
deductible plan,
Low
the
deductible.
300,
I knew
600
what you
plan.
meant.
We got you.
I mean, yeah.
And we have had an increase in the number of enrollees into the high deductible health plan over prior years, but that was the other thing we had asked Ann to do, is to look actuarially at the two plans to see if there's much advantage over the high deductible health plan versus the 600 PPO plan. So,
And we are looking at that, yes. Looking at our actuarial value model. So on page 5, if you look at the bottom box on the right-hand side, right now you're funding at $1,268.01. That's the number that we rolled into page 2 and compared that to your expected cost for 2019.
That's the cost per member, right?
That's per enrolled employee.
Employer, right.
Mhm.
Yes.
Okay.
Then on page 6, taking the same plan designs, and we rolled everything forward with the 10.8% projected increase. So everything's just gone up 10.8%, the employee portion and the county portion.
And so you did not factor in what our options are as far as utilizing some of our healthcare reserves
It's
to
on the next page.
offset the, okay.
That's the next. And then on page,
That's the question.
it's not numbered, it would be page 7. What we've done is we've rolled 2018 forward. We've increased the premium equivalents on the left hand side to 10.8%. We've only increased the employee portion 7.5%. The rest then, the difference then would come from the county, either through accruals or through the reserve. So the bottom line then would be a 10.8% increase overall. The employees would see 7.5%. The county would see 11.3%.
Craig, what's, this page that I asked for that you handed out, see, it's kinda, what's the difference there in this one, the single sheet, the one I asked to be done? You know what I'm talking about?
That one, we applied 7.5% to both the employee and the county,
Right,
and then the rest would be reserve.
so it's just, from the county's perspective, it's just
What bucket it comes out
bucket
of.
it comes out of.
Yes.
Yeah.
Yep.
But I think the way we would do it is we would do it, not to get into our accounting, is to get the 7.5, that's what we would increase the premiums by, and we'd have the county premiums increased by 7.5 too, and then what we have, what is called the medical insurance fund, this is fund accounting, it would get paid out of the reserve of the medical insurance fund, so, it wouldn't be, because if we did it the other way, it would be a general fund expense, whereas if we would just increase premiums for both sides by 7.5%, then we would fund the difference from the reserve in the medical insurance fund, which would be a non-general fund expense, which would be to our benefit.
So the 11% is paid for by two different pots, right?
Yeah, well,
Basically.
in essence, we're saying that, total, the projection for total premium expense should go up 10.8%, but we would only have employees and the county matching or county contribution on that only increased by 7.5%, and then fund the additional, 3.3% from the reserve. Yeah.
So you would like to have it broken out that way?
Yes.
The way?
He would like to have it broken out that way, so it shows the employer contribution at 7.5, the employee contribution at 7.5, and then the difference shown as the amount that needs to come from the medical reserve.
Yeah, we would just fund it.
Yeah.
So we did break it out that way, but we didn't know if that's how you wanted to present it today.
Yeah.
And so that's why we had the other one in there, so.
Yeah.
That was my call, actually, Joe, so that's,
And
I'll take a point for that one.
It's okay, we can get it.
It's all good.
So what we're saying is that, the projected premium is supposed to increase 10.8%, but because we have some adequate reserves in the medical insurance fund, basically we could fund, about a third of that
Out of
from,
that,
out of
yeah.
the reserve, so that employers and everyone would just see a 7.5% increase in premium.
Okay.
Which is still high, but, this is just what we were talking about, this cost is.
Continue to grow.
And it's based on experience, where our costs are just increasing.
did look, and over, since 2015, your claims have increased about 6.5% annually. Which
Since 2000.
in 15.
We're trending below.
It's probably right. So it's not out of line, but it is, it's money.
And it increases every year. It never
Right.
goes down.
Right.
It never goes down usually.
And we've gotten a lot of a little benefit from switching people out of the $300 deductible. So that's even in that. That's because we do have an aging workforce.
Yes, we do.
What's our average age? 46.
Speak for yourself.
What do
I
you
like
call
that.
aging these days?
I know.
There you go.
That is basically the medical and RX renewal in a nutshell. We do have a little bit of work left to do on the stop loss and to get you some information on the actuarial values between the plans, so we can look at maybe changing contributions, skewing it a little bit, depending on the value between the plans and what the contributions are.
I'm gonna say it again, changing, what do you mean changing contribution?
Well, we need to look at the value between the plans, the actuarial value between the plans, and to see if,
That's more of a strategic level discussion about
That's what we talked about the
possible
last meeting.
changes in plan design if it's.
Well, just remember, any point changes in plan design would have to be negotiated with some different unions.
Yes.
Over 17 contracts, so,
Yes.
Have a small endeavor.
just, just to throw that out there.
Job security.
Not that it's not easily
Marcos is absolutely thrilled. I can
So-
tell.
Marcos is going, yes.
So deductibles too would have to be negotiated?
Yeah, absolutely, yeah.
I didn't. Thank you for clarifying that, because I wasn't sure about that.
Oh,
Because
absolutely.
the contracts don't.
Oh, yeah, there's no
It's case law.
question, it's case law, yeah.
Okay,
Yeah.
thank you. That's helpful.
All
But
right.
that's only if we reduce benefits.
Any change, even if you improve
Even
it.
if you add a benefit?
Yeah, in fact, when we offered to put in the
High deductible.
the high deductible plan, that ended up having to be negotiated, but all the unions ultimately said, we'll take it because it's in the best interest for employees. But at first, a couple of them balked, because they said, we want to negotiate what that looks like. And then when we said, finally, we just want to offer it to your people, we'll offer it to everybody else, they said, well, okay, we'll take it. So, any change is subject to negotiation.
And do these, Craig, do these numbers for the retirees incorporate that 5 percentage point increase in their portion of the payment?
they do not, and that's a good point.
So that's something that we would want to put in
Yep,
there.
yep. And I did have that down, and I didn't bring it.
So yeah, when you put your final version for the retirees, make that adjustment.
Okay, anything else on?
The next piece there is the dental, the Delta Dental ASO, not Delta Dental Nebraska. It's not labeled, but it would be similar to the medical, the layout, ASO fee. Right now, you're at $3.05 with Delta Dental. It's in a 1-year guarantee, but pretty much anticipate they'll come back with a flat increase if they haven't already. They've been pretty much flat for quite a while. $85,095 is projected ASO fees for 2019. The next page, we did something similar. We've taken the fixed cost, $85,095, projected your dental claims at $1,315,206. Total cost then for plan year 2019 at $1,400,301. Divide that by 12, divided by your current enrollment of 2,235. We show we're projecting the total expected cost per employee per month in 2019 to be $50.19. And show that you're currently funding at $51.69. So it'd be a 2.9% decrease on your current funding in order to cover next year's projected costs. Not all bad news.
Not all bad news.
On the next page is, on the next two pages is our projections of the claims and the experience that went into that projection. We're using 4% trend, which is the prevailing dental trend right now. The marketplace has been 4% for years. So you're looking at almost a 3% decrease in a market at 4% trend.
Okay. Any questions on that? What's the, go ahead, what's the next
Oh, I was gonna
step?
say, so, on the renewal, so next step is, finalize the, the contributions and that. We were provided a couple sheets on that, as we discussed, that aren't included in there. And then it's, we got the stop loss still hanging, we've got quotes out, that should, I believe that's Thursday of this week.
Yep, waiting for that.
And then changing that retiree contribution a little bit, so we'll finalize it by the end of the week, get back to Patrick and that. So if there's no other questions on the renewal and the dental, Jolene's gonna go through the, LTD and the HSA marketing that we
The
did.
LTD is just the one pager that we passed out.
Okay.
The long-term disability is currently with Cigna. You've been with Cigna since July 1st, 2015. So this is the first renewal coming up, 1/1/19. The current LTD rate's 32 cents per $100 of payroll. And Cigna is asking for a 25% increase to go up to 40 cents per $100, which is about almost $100,000 dollar increase from current. They are giving a 2-year rate guarantee, so until 1/1/21. The loss ratio with Cigna, you've had 14 claims since 7/1/15. There's 10 long-term disability claims that are still open and 4 are closed. But your loss ratio to date is running at 163.3%.
That's not on this sheet, right?
That's not on
Okay, I was
there,
gonna say,
no.
I'm not following
Nope.
this at all.
But
Okay.
that's the reasoning behind the large increase.
Is because of, say again, the number of claims.
The number of claims, the loss ratio, premiums versus claims is 163%.
Okay.
And Cigna did say when they first came out, the underwriter wanted to give a renewal rate of 46 cents, but they did drop it to the 40 when they presented it. So again, we can send it out to market if you want.
We can, but usually when you have that kind of a loss ratio, you're not
Yeah.
gonna see real competitive bids. The other thing is that we have to keep in mind is that while this seems kind of like sticker shock, you have to remember that these claims used to go against our pension plan. For people that were that had been employed for longer than 5 years, and they're not going against our pension plan anymore, so they're being covered under a fully insured plan, and so, over the time period, the number of claims that we've had are not that different than what we would see year over year with the pension plan. There may have been a few more claims because now employees are able to access this benefit before 5 years, which previously under the pension plan, they had to be employed 5 years before they could get access to a disability plan. There might have been a few extra claims due to that, but I think for Cigna to come in, I don't think that they set the rate maybe appropriately for the number of claims that we were gonna end up having. It's hard for them to know when they're coming in blind, and we couldn't give them real great data, I don't think, at that time. So.
And this is again, what year are we on with is this a long-term one too, like a 3-year?
It was
and
3
then
years
an
and we entered in 15.
that we entered into in 15, so it would potentially go out for bid again after this year.
Yeah.
Okay.
And we can maybe see how claims are trending at that
that
time.
time.
And then we might be in a better position to get better rates then.
Okay. Okay. Any questions on that one?
No, I don't think it makes sense to put this out for bid either, given what's driving, our experience that's driving the loss, I just think,
Kind of get exercise of utility.
we know where this one.
Okay. So
Next.
then the age.
So
Okay.
go through
No.
to next.
Yep.
The HSA administration for the county, we're currently with Union Bank. And it's coming up, off the contract at the end of the year, so effective January 1st, 2019. We did send out an RFP for the HSA administration. If you jump to page 4, and that's that one right there. We sent the RFP out to 8 different vendors, plus the incumbent, Union Bank, and they all came back higher, except for Union Bank did decrease the current rates 25%, so it'd be about a $420 decrease for the year. Discovery Benefits is the only vendor that came in, and they matched with a competitive quote, and they matched Union Bank's renewal. If you jump to page 6, the financial comparison, this is the total dollars. The first 2 columns you'll see is the current, currently it's $1,680 for the annual cost. And effective 1/1/19, it'll go down to $1,260 with your current vendor. As you can see across, it varies between, say, a 12.5% increase up to a 37.5% with Optum. Discovery Benefits, they're the ones that are your current COBRA and FSA vendor, and they're the most competitive bid that they provided, and that was matching Union Bank's renewal. It shows the actual rate per employee per month on page 8. Currently, the monthly maintenance fee is $2 per person per month, and they're dropping that to $1.50 per person per month. They initially came out with a 3-year fee guarantee, and since Discovery Benefits, their proposal was a 5-year, we did go back to Union Bank, and they did agree to extend that another 2 years, so that would be guaranteed for 5 years.
Competition is good.
Yep.
So a little plug for Union Bank. I personally use them, and I'm pretty sure this is the only benefit that no one has complained about at all. So they're doing something right.
And the other thing is if we were to move, it would create some hardship on the employees' part because they would have to establish accounts. There might be fees associated with them for doing that. And then if they have any kind of investment part of it, it would create more problems for the employees, so.
Yeah, if you look at like page 10 through, page 10 through 14, 15 actually, I mean, all of them have a little bit different things as far as the minimum threshold for investing on your HSA funds. Some have costs if you lose your card, some don't. What the investment fee percent is, and they all vary, but when we did a high-level look, Union Banks was just as good, if not better, than the other vendors. That's pretty much it.
Okay. Any questions on that renewal? Okay, next one, that's it.
That's it.
Okay. So again, just walk through again, we need more information on the, one, right?
Yep, right, so we'll add the increase for the retirees that we talked about, we'll do the 3-legged stool, so to speak, with the contributions. We've got a couple bids out on the stop loss, we should have those by Thursday, we'll put all that back together. Assuming they come in on Thursday, we'll put those together and send them to you Friday or Monday. Probably Friday, I think Craig's out next week, and so we wanna get that to you before, so.
Okay.
Does that sound good?
Yep.
Okay.
Alright,
All right.
anybody have anything else? Okay, thank you.
Thank you.
The next item is our pay grade consolidation.
Mm-hmm.
Okay, this is something that we have talked about before in previous HR committee meetings. I think we're finally getting ready to pull the trigger on this. We wanted to do it sooner in the year, so it's not a last minute thing, November timeframe, trying to get an HR committee meeting together. So I thought we'll just get this done, and then we have a lot of our planning for next year's financial situation taken care of, at least the fiscal year. So basically, this is going to be repeating this information for those of you that have been to these meetings before. We have some overlapping in our different pay scales that we've got, so we want to condense those down where we can, where it makes sense to, so that we don't have as many pay grades that are unnecessary. We'd also like to see the board approve 3 years of pay scales for non-union employees like they do for union. Something, again, we can maybe streamline this process a little bit, just to make things easier for everybody. As we go through, I've got up on the screen there color coded so you can see a little bit more clearly on which grades that we're talking about. So we're going to talk about the range structures right now. So the range structure has basically a defined minimum and a defined maximum, and it's up to the department head, elected official, to make pay adjustments whenever they feel the need to, subject to proper approval, of course. And so we've got overlapping grades that are all very similar. And so what we propose is to change this so that there's a little bit more space in between each grade, and the grades are a little bit wider spread to encompass the salaries of our employees. We're completely changing the naming structure so that we can, break the old mold and just go with something new. Here's how it's going to be, and so we don't have any confusion about what used to be in existence, et cetera, et cetera. And so this is what it would look like for 2019. And then, so looking at our costs, which is always a concern. So what we did is we looked through the rest of the fiscal year. And so to do this consolidation, there's some people that are below the new minimums for these ranges. And so that's essentially where all the cost is for this, the first number, the $24,660. And this will be a cost that will basically be at the beginning of the year and then carry through. And also looking at a 3% increase for all of the range employees, which is something that I think Joe has kind of planned for in budgeting, generally speaking. He may disagree, and that's okay. But okay, and so we're looking at about $180,000 for the rest of the fiscal year. So we're going to look until July 1. So the grand total that we're looking at is going to be about $205,000 for the range grades. And so this is 100 and some employees, roughly, right out of 100, about 100.
And just to add a comment, in the past, we've been doing 3+1 to catch the range people up with the steps, but we feel like we've achieved that, especially if we can do the consolidated grade, and we don't anticipate that we would have to make adjustments on that for some time again, and hopefully not ever, but this would allow us to no longer would have to do the 1% catch up, because we feel like we've reached that point now, where a few years ago that wasn't the case, and we were asking for 4% for the range people.
Right. Okay. And so just sort of a visual of what those grades might look like in a situation where we approve them for 3 years. So we know exactly where the ranges or grades are going to be 3 years out. We can plan for any increases and things of that nature. The people that are on step grades, it's a little bit more complicated, but we're still talking about the same concept. We want to consolidate where the old G and M grades work together or overlap. So there's no confusion about which group of grades it should belong to. So we go from 16 grades down to 11. And of course, we want to look at also a 3-year approval of a 3% increase per year. Some administration rules that we want to enforce as well is that if somebody's over the range maximum, they don't get an increase until the range catches up with them. And then we're going to move people to the new scales that I'm proposing on their step date. So it's not an immediate January 1st cost. At some point during the year, they'll be moved on to this new grade, and then they'll continue on in their step progression from there.
How many employees are we talking about who are non-union?
Roughly 200 that are on the step, and about 100 that are on the range.
Okay. The other thing that's really nice is, for those of you, and I think, well, I know Claire and Mary Ann were still on the board when we had Fox Lawson come in years ago. one of the things they talked to us about was consolidating these grades, these two different structures, but also so that we could better manage employee to subordinate salaries to make sure that subordinates weren't encroaching on supervisors that they were reporting to, and having multiple pay scales, it's much more difficult to do that analysis and make sure that that isn't happening. And by having a single grade structure, such as combining the G's and the M's here together, it will make it much easier for us. Because M originally kind of stood for management, that was the scale for them, and the G was for just the general workforce, and so that's a big reason why we wanted to do this, and just follow through with those recommendations.
And so we'll essentially have two grade structures, and there is some overlap because of the nature of our positions. But it will be much more distinct, and it'll be very easy to tell where folks are at relative to their subordinates, of course, too. So these are the grades that in the current structure, and then this is what we're gonna propose it to look like. Again, changing the whole naming convention and everything with it. And so there'll be some of these grades where we may have people that are exempt, so they're paid a salary as opposed to an hourly amount, so we'll convert those over using 2,080 hours as the standard formula for that. And so then, brass tacks, of course, the cost. More cost, but we also have, double the number of employees. So we're gonna already look at about $195,000 for their 3% increase that does hit on January 1. And then throughout the year, the rest of the fiscal year, there'll be about a $27,000 incremental increase to those individuals to put them on this new pay scale plan. So overall, about $223,000. And I put page numbers at the bottom because I was hoping Commissioner Boyle would stand for us. I know that he would appreciate that.
I'll make sure he sees them.
He always asks for page numbers.
He does.
So we'll take care of that. That's
We'll make sure he sees the page number.
Questions, comments, concerns with any of these plans? And we just want to make sure that what we're doing, it makes sense for our employees, makes sense for our budget, and it makes sense so somebody can easily look and see where they're at and maybe plan for their future career.
So the committee here would be recommending to move this forward to the county board at some point. And we obviously want to do it sooner than we have in the past, in case there's.
Well, we wanna have it in effect for January first.
But we always waited until.
October, November, and then we were scrambling.
Right, so if we put it on for, discussion, and then shortly after that for action, and then whatever our schedule is, cause I know we're off a couple of, meetings because of the holidays coming up, but we can most likely get that done in the next month or so.
So, you just let me know what,
When you're ready to put it on, and we can put it on under the HR,
on the county.
on the county board. Yeah.
Okay, one more thing, and then hopefully it won't take very long, because this is a really good thing for our retirees, and, yeah.
Wow, that's unusual.
I know. Well, okay, so to be completely transparent, it's also a very good thing for us.
Oh, yeah.
But, so, right now, retirees can stay on their insurance plan until age 65. Well, right now, they have to send us a check every month for their insurance premiums. So we get 300-ish checks a month. And so what we've been working with Mutual of Omaha to do is to take those deductions.
And then you also have problems when they don't send them in that you're kind of playing bill collector.
Oh,
Yes,
we are
sir.
definitely.
Yes, sir. Yes, sir. And so this is going to streamline that process. And so what we've been working with Mutual to do is to take those premiums after tax, just like they are now. And so Mutual will essentially take it off the top and cut us a check every month for all of those premiums. And so we just deposit one check instead of several hundred.
So Mutual's doing that instead of the employee.
Correct. Yep. So it's gonna save them postage, it's gonna save them from having to come downtown, et cetera, et cetera.
And they just would take it out of their payment, or?
Yeah, out of their pension
So
payment.
it's not like the employee would be sending Mutual a check,
Correct.
so it would be all.
It's a pension deduction it's a deduction from their pension payroll, basically, that Mutual does for us. There is a cost.
Yeah.
Say,
and-
what's the catch?
Well,
Has
it's a very small catch, actually. It's a $25 fee basically to set this up. And I've been talking to Joe, and he said that there's enough money in the pension plan to maybe fund that initial expense, which will be less than $10,000 to Mutual to set all that up for all of our retirees.
$25 per retiree or what?
Yeah, just per
One
Oh,
time, right?
one time fee.
Yes.
Yep, just one time to set it all up. And so with that, it has to be a voluntary program.
Okay, wait, I have one other question.
Yes.
That $25, is it, so Claire retires tomorrow and I retire next week, then that 25 gets charged to us as well?
No, this is just a one-time fee that we're going to pay for to set up all of the retirees that are currently in existence. And then as new people
That have
retire.
insurance, that just have insurance.
If new people
Right.
retire, then they charge what? Then we have to pay the $25 every time. Right.
Yeah.
For new people.
Yep.
That's
we're-
what I'm asking. So
Yeah.
we're not retired, so we're new
Then
retirees.
we'll pay the
Then we
25.
have to pay the,
So it's gonna be more than 25,000, because going forward, it's gonna be every
It'll
time.
be an ongoing cost for every retiree that retires
So,
after
average
this.
5 to 6 a month, it's, a couple $100s a month is what we're looking at to save from having to collect in the checks from people and having to, have them be late, et cetera, et cetera.
That's totally worth it, I think.
Absolutely.
And
Considering-
plus the amount of time that we have to spend in our office to process all the checks
And we
so-
have to work out payment plans with individuals because they fall behind 6 months, and then the retiree rate is so high right now that for them to have to repay because they haven't paid us, and it takes them a year to repay us, and then we have to stay on top of it, and
This is a no-brainer.
so Matt has become a collector,
And before Matt, Kathy did it.
yeah.
It's ugly. It's an
Yes,
ugly
it's-
business
it's
for
not
sure.
good.
So with that, what we'd like to do is, I guess, apply a bit more of a stick to the whole process. Yes, it's voluntary, but we want to add some rules and have the board's support on those rules. That if the payment has to be received by the end of the month, so if they don't elect to return the form and to sign up for this program, this is when these rules would be in effect. Otherwise, they're not going to be applicable because it's just going to come straight off of their pension payment. So we'll give them a grace period of 15 days after the end of the month to pay. But then if it isn't received by the end of the grace period, we're going to cancel their insurance back to the day that that they were late. So the couple of examples that I have here at the bottom. So John owes for his January insurance and he pays on 2/5. He's still okay. He's within that 15-day grace period. Bill doesn't pay, and so we're going to cancel his insurance back to January 1st. And so any of those claims would be reversed through Blue Cross Blue Shield, and they'd be on the hook for those claims.
why not just make it mandatory?
We can't.
under the law. Yeah,
We
Pension
asked.
Protection Act. Yeah,
Oh.
we tried to.
The
Believe
county
me.
attorney's office said no.
We do
So
it
if
for,
you
we
reverse
do it for
all those
employees.
claims going back to January,
We do it for employees.
to where that person basically had no cover
Well,
retroactively,
how can we do that?
then how do you pursue that?
Well, we can't really. I mean, it'll be between Blue Cross
Blue
and the
Cross and-
providers.
So Blue Cross will
provider,
have to,
And then if they get money back, then we would get money back.
but they would go after the employee or the retiree?
They would go after, the
Yeah,
providers.
Blue Cross or the
The
provider
providers
will.
would then go
I
after the
see,
employee.
okay.
But they can avoid all of that by having the premiums taken off the top, and there's,
Right.
it's never late, there's no problems that way. So, where we're at in this whole process is that we've got a contract together with Mutual, and it's just across the street with our pension attorney for double check, make sure everything is cool. And then we'll be proceeding with that as an agenda item for the county board.
Diane?
I'm curious why we can't make it mandatory, because we make it mandatory for employees, don't we?
Under the Pension Protection Act.
Pension protection.
According
Okay.
to the county attorney's offices, it has to be voluntary, and Mutual of Omaha also confirmed that because we first approached them before we talked to the county attorney's office, and they said, no, you can't make it mandatory, and then we went to the county attorney's office to double check the information we got from Mutual, and they said, no, under the Pension Protection Act, you cannot make any deductions mandatory against a pension.
Without them affirmatively electing to do so.
Yes.
Marcos?
Is that, I guess that's my question, is it like that, or is it where we can make it an opt-out, where's the threshold for voluntary? Meaning like,
They
we
have-
tell them, hey, this is what we're all gonna do, we're gonna give you two
It has-
opportunities to opt out of it?
It has to be an opt-in.
It has to be affirmative.
It has to be an
It has to be
opt-in.
affirmative election.
The Mutual won't do it unless the employee signs the form that we've come up with, that has all the legal mumbo jumbo, so to speak, so.
I know, we were
I know,
disappointed.
it would, yeah, we really wanted to make it a mandatory thing and just.
And we're
Well,
hoping
yeah.
that the retirees will see the benefit of this, because they won't have to worry about sending a check in, and they won't
Right.
have to worry about
Right,
maybe
sure.
paying 6 months at a time, which some of them do, and then trying to remember when that 6 months is up, and
So how are we gonna educate them on this to make it a good thing rather than, here we go again?
Well, I've got a letter that I've been drafting that I'm going to send out this year with open enrollment. Once we have the premium rates finalized, we'll be able to get that communication out to all the retirees. And so we'll be able to say, hey, this is a great thing for you guys. I think that just off the top of my head, probably 99% of the retirees are gonna be happy about it. It's gonna be the 1% that don't have their financial situation such that they think that they can afford that right off the top and those types of things. So we may still have some of these problems, but we are framing it as a positive thing because it really is. It's a convenience for them. Every single new person that retires says, can I just pay my premiums with a credit card? Can't you just take it out of my pension? One of those two things. And so we can finally offer that to them.
it's peace of mind, they won't have to worry about whether it comes to us and we process it in a timely basis,
Every month,
and
right.
it'll be convenient. I think we can package it so that it's positive.
Absolutely.
Okay.
So I think our biggest question that we wanted to present though to the committee was whether or not there was any issue or concerns with the payment rules that we want to apply regarding the 1 month plus 15 days and then taking the insurance back, and because that's probably where we're gonna hear the biggest outcry is the first time somebody gets canceled, and then we're retroactively taking their coverage back to the first day of the month that they didn't pay the premiums for, and they may have incurred some claims, and they're gonna complain about it, I think, so. we just
Or they
wanted
could
to-
just pay their bill.
I
think
agree.
you need to, my opinion is that you need to make the same presentation at a county board meeting, because there's only 2 commissioners here, and they're gonna get the phone calls.
Yep.
So, yeah.
Oh, absolutely, it has to go to the county board. Diane?
Is the 1 month and 15 days grace period consistent with what we do for current employees who don't pay because maybe they're on an unpaid leave and they're,
It's funny you should mention that because we don't really have a great system in place right now to.
well, the plan talks about it. So I'm just wondering, I thought it was 30 days. I don't know if there's a grace period in there anyway. I'm just saying maybe we make it whatever the plan says
Yeah, we
for the
can-
current employees.
we wanna follow what the plan says for the current employees. For the retirees, I don't know if we wanna match it up exactly the same. We can,
I don't care either. I just wondered if you knew if that's what the current plan is.
You can take a look at this and when
I think the current one says 30 days.
I think
if
it does.
remember right, it's 30
Yeah,
days.
I don't think there's an extra
But I
grace
think we were
period.
figuring that these people, whereas the active employees, we can take it from their paycheck, and there's some onus on us to inform them. We need to do a better job of that than we've been able to do in the past, because we haven't had a good way of capturing that information, and we're working on improving that. But I think that for the retirees, I think we were thinking the 15-day grace period, because if they're not gonna do it through their pension, that, we wanted to give them a little extra time to get it mailed in, plus allow us time to process it before the end of the month.
All right, well, just when you're ready, let me know, we'll put that on the HR committee as well.
I've got one more quick thing. I went to a presentation with the city of Omaha. This consultant that works on 457 plans. And there's been some changes there in fiduciary responsibility. And, the city of Omaha is just like us. We have 3 different providers. We have Voya, American Funds, and Edward Jones. And,
Nationwide is on your side, so 4.
4. We have 4 nationwide.
I think American Funds and
And so might I think of the same now?
No, well, we just had Nationwide come and sit in the conference room saying,
Oh,
we wanna.
okay.
They're not the same. There's 4 different.
Okay, there you go.
Yeah.
We have 4.
So, anyway, we have 4, and the consultant came in and said, what what they're advising is kind of from like a fiduciary responsibility, that you have them in and then they look at the different funds and they evaluate their fees being charged and make sure that they're equal, the plan documents are right. And how this would be, you would pay for them is like, it would be a 3 or 4 basis point charge that would be taken directly out of the contribution, to the employee's contribution. And it was interesting, so what I said, I would talk to you and maybe see if you think it would be worthwhile to have the consultant come into the next time we have a Human Resources Committee and make a presentation of the Human Resources Committee and take everybody through that. And I think it's worthwhile because and so is the city, are a little worried about some of the fiduciary risk. There's been some court cases that are holding people or organizations accountable, even though it's really not a company or county sponsored plan. So if it's okay with you, I would talk to him, and next time we have a Human Resources Committee, have him come down and give the presentation.
Sure.
Yeah? Okay, that's all I had.
Okay, anybody else have anything else for the good of the cause?
That went back to juvenile justice for me.
Sorry, it was just.
It was open. I don't know why it was still there.
Okay.